that all the presentations are 15 minutes, including the question and answers. So if you take your time, 15 minutes, there will be no time for question and answer. And if you would like people to ask questions from you, leave some time for the discussion. Thank you.
Good morning, everyone. Thank you for giving me this opportunity to present my case today. So today is a case report about one of my patients that I had during my residency last year. A 26-year-old man from Northeast area in Maine presented with a chief complaint of loss of weight for 80 pounds in a very short time with chronic cough. History of presenting us in January 2006. He was doing the training in the Army in Texas and Oklahoma, and he developed flu-like symptoms such as cough and runny nose. And first of all, it was a dry cough, and then it turned to yellow sputum that changed the color to greenish, and then they diagnosed a pneumonia. And they started treating for CAP, or community-acquired pneumonia, and but the symptoms were still ongoing. He got a sick leave, and until October 2007, as you see, almost a year, still the symptoms were ongoing, and he lost 60 pounds and adding that 20 pounds, 80 pounds in total weight. And finally they did a chest CT in the hospital, and they found a cavitary lesion 3.3 by 3.4 centimeter. I want to show this. This is the CT scan, as you see. It starts from here. See, it's the normal tissue, and then the cavity here. And finally, in February 2008, in the follow-up CTs, they found the cavities increasing in size, and they cultured the sputum, and they found coccidioidomycosis. This is the X-ray, and you see on the right lower lobe of the lung, the cavity. In April 2008, it was confirmed by a PCR and bronchoscopy. As you know, that's the confirmation diagnosis of the coccidioidomycosis, and they started diflucan or fluconazole and augmentin treatment for this patient. In June 2008, again, a CT chest shows this time a reduction of size, but some air fluid levels. August 2008, some pulmonary function tests were done, as you see the results. And September 2008, he presented to our hospital for that complaints that I mentioned earlier. The review of systems, he had these fatigue and weak, having night sweats and productive cough, severe weight loss, as I said, and some hip pain he developed. Left side was more than right side, but no GI symptoms. And he had also some sharp frontal headaches. That was kind of concerning, but was getting better with 800 and sleep. His social history, he was a previous construction worker, and he had some few sessions of training in US military, and he was single, no partners, no recent sexual encounters. He was a smoker, And he had 3 brothers, all healthy, and all contacts at home. They were healthy. No pets. On physical exam, the positive pertinent findings are, he was just pale, looking cachectic. You were feeling that this guy has a diagnosis such as AIDS or some immunocompromised process was ongoing. That's the first impression that you could get from the patient. And he was kind of depressed. He had some discoloration, a plaque on his right elbow. The rest of the physical exam were normal labs. As you see, there is not any positive findings. We did all PPD tests, HIV tests, and it turned to be negative. So today we are talking about this coccidioidomycosis, which is part of the mycosis systemic or endemic mycosis. There are 4 major ones, and according to the region in states, we see 4 different parts. This coccidioidomycosis is seen mainly in southwestern in California, and towards the east we see histoplasmosis, and I don't go into details. It starts with, they have 2 life cycle. It starts from kind of mold or in vitro cycle, and then inside the body, and dissemination finally. I have some slides here. These are different names for this. So this is the spirule, and in the body it bursts, and the conidias, they spread in the body. And this is a good slide. Shows the saprophytic cycle and parasitic cycle. This happens in the soil, and this happens in the body. So the reason sometimes the earthquake or people who are dealing with the soil, they get this coccidioidomycosis more frequent is because of the cycle, and they have to inhale the dust and the conidias. So the primary infection usually is symptomatic. There are a lot of people with this infection that they are not aware of. And in fact, we don't need to treat those people. But then it can spread and cause some systemic and very severe symptoms such as meningitis and this kind of pneumonia. The symptoms, as you see, there are some constitutional symptoms that are more frequent. Fever 61%, fatigue 59%, and these were in our patient the same as you see. Also, he had headache, he had chest pain. Doesn't say weight loss, but that also is mentioned. Is very, and some erythromelalgia, as you see here, 9% we can see. So the diagnosis, there are different types: serology, culture, and skin test. Skin test is not being done in states anymore for some reason. We have PCR here, which is more accurate. I guess that's the reason. They don't want to waste the time. Frequency, mainly on here, as you see, southwestern states, and it goes to Mexico and some parts of southern America. You can see these in history. We see these. Most cases are subclinical and no symptoms. And it can cause, so on physical exam, this is the main findings. You can see some pulmonary findings according to that cavity that we can see in the patients, or also extrapulmonary findings such as skin, as I mentioned, and bone osteomyelitis, and some arthritis, arthralgia, and some signs of meningitis you can find. Risk factors in immunocompromised people such as AIDS, lymphoma, steroid use, and diabetes, also in pregnant people. So the pulmonary process, there are three types. It can be nozzle with no